And I'm Nick.
And welcome again to our YouTube channel. If you want to make sure that you're up to date with all of our videos that we upload, just like and subscribe. And again, thank you very much for sending your questions, and we're doing our best to answer your questions. Yeah, so today, Nick, we're going to discuss the AMC Part 1.
Yeah, okay, that's right. So AMC 1 is the first part of the Australian medical examinations. Everyone who wants to work as a doctor in Australia must sit the AMC 1 at least. So, Danica, what's the AMC 1?
What is AMC? It's the Australian Medical Council multiple choice examination exam. So the structure of it, it's a 3.5 hour examination. It's computer based that you can take in an accredited center. It's usually present in each country, and you can take, and it's about 150 questions, right, Nick?
Yes.
And there's only one correct answer within those 5 choices. All right? And what does it assess?
So basically, the MCQ exam is a test of your medical knowledge. So it usually deals with asking questions about history, physical examination findings. You also have questions about investigations, interpreting investigations like blood tests and imaging sometimes.
And even clinical images like
fundoscopy images, chest x-ray images. Also, most of the time, they ask questions about treatment, whether it be medication or referrals if you need to refer the patient. So it's mostly a knowledge-based test. And there's actually a breakdown of what categories are asked in the exam.
Yes.
So as Danica said, it's a 150 item exam. 30% of those would be about adult medicine. 20% would be about surgery. 12.5% would be women's health or ONG. 12.5% pediatrics. 12.5% mental health. And 12.5% for population health.
That's the general coverage of the exam. So, in simple terms, it's basically everything. All right, but the ultimate thing that you need to know as well is it's not a cheap exam. So how much does it cost?
2,720 Australian dollars, and that's currently what's on the AMC website.
Yeah, that's as of year 2021. So again, guys, this always changes, so it's always best to have a look at their website to be updated about how this exam costs, and especially with this pandemic situation where you can actually have the exams. Okay, so we're now going to talk more in detail about the AMC 1 structure. Okay, so we talked about earlier that it's a 150 question MCQ exam. 120 of it is actually live questions, which are very counted in your scores, but 30 of which are pilot exams.
So only 120 items are scored, only 30 items are pilot questions, which are unscored. But the thing is, you wouldn't know during the exam which of those questions are the unscored ones. So you really have to give your best answering all of those questions.
So what makes this special is actually, it's called the computer adaptive test. So what does that mean, Nick?
So it means each candidate will actually have a different exam. So the very first question of the exam is random. It's going to be picked out of their pool of questions. And based on your answer for that first question, the second question will either be more difficult or easier. So let's say you get the first question correct. The second question will be a little bit more difficult. And if you answer that correct, the third question will even be more difficult. So if you get the question wrong, the next question is easier. So if all your answers are wrong, the exam is easier.
Very easy.
So,
but if you're answering it right, you will notice that the question is becoming harder and harder and harder. So from what I could hear, usually the successful candidates really say that, oh my God, that has been the most difficult exam that I ever took in my life. And it's no surprise that they really succeed in the exam. Yeah.
So what that means is you can have two candidates take the exam. They could have the same number of correct items, but they wouldn't have the same score because one would have answered a more difficult test. Another person would have answered an easier test. The person who answered the more difficult test, even if they both have the same number of correct items, he would have the higher score.
And I think they also do a scale based on the difficulty of the correct answers that you've done. So it's a scale from 0 to 500. And 250 is the passing mark. So basically, it's a pass or fail examination. If you reach the 250 mark, then you pass the AMC 1.
And then you're eligible to take the AMC 2.
Yes.
Which will be another video.
Yes, of course, yeah. So one tip that we've heard from the people who took AMCs is actually the last 20 questions of the exam are all counted. All right, so that's a tip. So basically,
so what that means is you really have to finish the exam because if you don't finish all 150 items, let's say you only get to number 120, that means you automatically lose 20 points because the last 20 items are actually scored.
So remember that, guys. All right, especially when you're taking the exam. All right, so the next bit of our discussion today is actually how to prepare for the AMC exams, okay? So maybe you can share about your personal experience?
So I think Danny's right. The amount of time you need to prepare for the exam is different from person to person. It really depends on what your background is. So some people who are just out of medical school would probably just need lesser time preparing for it. But I guess people who are very advanced, who have specialized, have 15-20 years of experience, might find it a bit more difficult going back to the basics. So they might need more time preparing for it because they probably would have forgotten all the basics of all the different aspects of medicine that they haven't done in a very long time. So personally, I haven't specialized back home, and I took the AMC 1 4 years after graduating medicine. I didn't have any money at that time to actually register for a review course, so I studied for AMC 1 by myself, just basing on what people have been suggesting online and watching vlogs, YouTube channels of other people. How I prepared is I subscribed to a Q bank online. There are many different Q banks out there online. Then what I did is I tried answering Q bank questions just to get an idea of how difficult the questions are. And then what I would do is after the questions, I would look at my answers and what answers were wrong, and that I would go back to those specific topics in the book. And specifically for Australia, they use John Morta's General Practice.
Principles of
General Practice by John Morta. And I would just pick on the table of contents those topics that I answered wrong in the exam. So I think it's very inefficient to read John Morta back from cover to cover.
Yes.
Because you don't really retain information like that. You retain information if you encounter a question that you don't know the answer to, and then you actually go back to the book and try to understand why your answer was wrong.
That's true.
That's how you retain information. There are a lot of different sources online, especially on the AMC website. There's the Anthology of Medical Conditions, and then there's a Handbook of MCQs, or Handbook of Multiple Choice Questions.
That's true.
Yeah, you can just get it on the AMC website.
Yeah, and usually the images that they use in the exam are actually those images that were discussed in the Anthology of Medical Conditions. So you have to be familiar of how these look like, okay?
Yeah.
So sharing from my own personal experience, I started my journey in the AMCs around a year after I finished my degree in medicine. And since I didn't have any idea about AMCs, I was convinced by a group of my friends to attend a review center, okay? I think there's a lot now that could be available in your home country. I think the advantage of this is actually you get to have a group of people who are also undergoing the same process as you, and you get to learn and have a good topic discussion, what to focus on usually, and you get to gauge your performance with these people and just reassure yourself that yes, I'm preparing it the same way as these people, yeah. And I think that's one of the advantages. And next advantage is also they could give you topics and resources just like what's available in the Q Bank. But one of the major disadvantages of having a review center is actually it's not a cheap price to pay because you're paying for a service, right?
Yeah.
Yeah.
And especially looking back now, I think enrolling in a review center for AMC 2 is a must.
Yes.
So definitely paying for a review center for AMC 1 is an expense as well.
Yeah,
So
yeah, that could be a really huge expense. But I guess it also depends on how you learn for yourself. What if you feel that you're the type that could learn from lectures? I think this is a good opportunity and option for you to take. But if you're the type who thinks that, oh, I'm the one who can sit and then try questions on my own, try to study on my own, I think you can study the same way as what Nikki did. All right? Yeah.
I guess the main advantage of attending a review center is you get the reassurance that what you're doing is enough.
Yes.
Because I think looking back, one of my major insecurities that time was I was just preparing by myself at home, and I didn't know of anybody else preparing for it. I didn't know anyone else who passed the exam. I didn't know any other doctors in Australia. So it was just me and the resources I got online. And I didn't know if I was studying correctly,
Yeah.
or if I was just wasting my time.
But you did completely well, Nick, in that regard.
Thank you. So
all right. So
I studied on my own, and I passed the step 1 on a first attempt. So it's definitely not impossible to pass AMC 1 doing just self-study.
that's true. Yeah. And I think what the main thing that you need to remember when you're studying for the AMC 1 is actually studying smart and actually understanding what the question really wants you to answer. Okay. So let's say like a general example. One of the common things that we want you guys to really know by heart is actually pulmonary embolism. What it is, how it's presented, how it usually presents, what the usual examination findings is, and how to actually investigate and manage this condition. Because this is one of the most common things that you shouldn't miss,
Especially in the Australian medical
setting.
setting.
Yes, that's true. It's pretty common.
Yeah. So,
all right.
just to give you an example of how tricky sometimes the questions could be in AMC 1 is you should really understand what the question is asking. So let's say you have a case of a patient with shortness of breath. There's a lot of differentials for that. You would have your pneumonia, effusion, lung cancer, pulmonary embolism,
Asthma,
pneumothorax, asthma. There's a lot, right?
Even like heart attack.
Yeah. So make sure to really read the question. For example, they have a few tricks. So sometimes they would ask, patient with shortness of breath, what is the next best course of action? Or what is the next best step in management? And you would get their chest x-ray. So obviously that's the next best step of action, because you would do a chest x-ray as a first test. But let's say the question is stated as a patient with shortness of breath, history of estrogen intake, history of previous blood clots, recent long flight. So very obviously it's a high risk pulmonary embolism.
Yeah.
And the question state, what is the gold standard
course of action? Yeah,
so you should not answer chest x-ray. You should probably answer CT, pulmonary angiogram.
Yeah.
So be very careful when reading the question and what it asks. So if it says gold standard, answer the gold standard. If it's asking next best step, you usually choose what you would do in a normal setting of the most basic test that you can do.
Yes. So that's one of the most important things that you really have to be aware of.
And it could actually make a difference. Let's say the question states you are a GP in an outpatient clinic and a patient with shortness of breath. What is the most best course of action? Of course, the best course of action is you don't do a chest x-ray. You call an ambulance and send them to the emergency department.
Yes.
So let's say you have a choice as chest x-ray, call ambulance and send to emergency department. You're not going to send them to an outpatient chest x-ray because you need urgent review. So you need to send them. So let's say the case states you're a resident medical officer working in the emergency department with a patient with shortness of breath. What is the next best step? Then that would be a chest x-ray, because obviously you would have a chest x-ray
in that setting. Yes.
So that's how
it's very important. Yeah.
So make sure to read every component of the question because it matters what choice you select.
Yes. And one of the other tips that we could actually suggest while you're studying this handbook of MCQs, all these MCQs, is actually you have to have a look at all the choices that you have in each question and try to have a think. If I'm asked this choice A, how would they potentially do this as a question? So study what the different choices are in the handbook of MCQs, because they are actually the ones that go in the exam. All right.
And another thing I remember as well, which is very tricky also, is sometimes you would have choices that are all correct.
Yes.
But you have to really understand the question. So let's say the question says, patient with shortness of breath, O2 saturations are 75%. What is the next best step? And you would have a choice of go get the chest x-ray done, administer oxygen via nasal prongs. What would you do? Obviously, getting a chest x-ray is correct. But of course, with the patient with desaturations, next best step is to give the oxygen first.
Yes.
So you should be aware of that. Questions like that.
Yeah.
And actually, subscribing to an MCQ bank is very helpful, because whenever you get wrong answers, you usually can read the reason why. There's a summary at the end.
Yes.
Explaining why the answer is wrong and why another choice is correct.
And why this is the best course of treatment and not the other option. Okay? So basically, that's what the AMC Part 1 is. So we're really hoping that what we've talked about today actually will help you in your own journey. Again?
All right.
Yeah, so if you have any questions, just email us in our email below, and please like and subscribe for more information. We're more than happy to make videos based on your request, and I think for the next videos we're also going to discuss AMC Part 2 and our journey here as doctors in Australia. Okay?
Alright.
So, have a nice day. Bye!
So I think it's very important to learn when you're preparing for the AMC2 what exactly the examiners want to see from you.
Yes.
Because you can be giving all the correct answers. What you're saying, what's coming out your mouth could be correct. But if you're not performing in a way that's expected, like you're saying the wrong things, you don't show any empathy, you don't have any rapport, you can still fail the clinical exam.
That's really true.